sympathy, people just give me weird looks.
That's not your hand, we should take that down.
So yeah, here we are. So now we are on the recorder. Good afternoon. So we'll just introduce ourselves. My name is Gift, and thank you for coming to this lesson, which will help me to be assessed on. It's going to be recorded. For those who do not want to be recorded, I would suggest probably switch off your cameras. And the etiquette, obviously, we will introduce ourselves before I start the lesson. We'll start with Catherine and then we'll go around.
Thank you, Gift. Hi, I'm Catherine Flynn, and I work in the quality team, and I'm training and development lead for DHC.
Thank you. And then Judy.
Hi, yes, I'm Julie. I'm recently new to the personal health budgets team, and I'm a social worker by background.
Thank you. And then Anna.
Hi, I'm Anna Pereira. I'm the operation manager for the North and Mid locality for the CNCT.
And then Nikki.
Hi, my name's Nikki. I'm one of the quality improvement leads, and I'm an occupational therapist by background.
Thank you. Jan.
Hi, I'm Jan Coles. I'm one of the clinical leads in the quality improvement team, with the main focus on fast tracks, and I'm a nurse by background.
Thank you. And then Natalie.
Hello, I'm Natalie. I'm new to the CCG. I work for the North and Midlands team as a specialist practitioner, and I'm a nurse by background.
Thank you. So what I'm going to do today is I'll have a PowerPoint which I'll share. We have two videos. In between there will be some discussion which will be led by the questions, just to discuss on the hand washing, why it is necessary for infection control. So I'm going to share that. Can everyone see?
Yes, can see it, thank you.
I'm going to ask Catherine to help me if there's any hands, because I can't see the hands, or if there's any hands to ask the questions. So as I've said, that today the topic is infection control, which can be prevented by hand washing. It's one of the methods of infection control in healthcare settings and our homes. And that's the reason why I sought to seek your help, to say if you could be present to support me in this teaching session. So I did send the email with that pre-reading information. I don't know how many read. If you didn't, that's okay. If I may start, did anyone read this? Had a time to look at?
Sorry, Gift, I haven't.
Thank you, Anna. It's okay.
No, I'm afraid I haven't either chance to.
Thank you. It's okay. Then we'll go through together. Thank
I
you.
had a cursory glance, Gift, because it was only polite.
Thank you so much. It's not an offense to not have read, but again, it's good that you just had a careless glance. That's okay. Thank you. So what we are trying to achieve through this teaching session, at the end of it, what we need to get out of it is obviously to understand the steps involved in hand washing. Through literature, I think it ranges between 7 to 13, but this has been added because of the current pandemics, so that's why we reach up to 13. The standard ones will go up to 12, but I took it because of the current environment. And then we'll try, I know if it was in person, we are going to do a demonstration to go through these steps, but we'll try, since we're doing it virtually, we're going to try to demonstrate virtually as well. but I have got a video to support us to see these steps as well. And then secondly is obviously the nature of healthcare work, and even in our normal life, is that we need to wash our hands in order to prevent some of the infection, either to our loved one or to those whom we care, or even after we obviously perform our tasks. That's why we need to do that. So we need to select an appropriate method of hand washing. And then I said in between, obviously, I added take part in hand washing if it was face-to-face, but unfortunately we're doing virtually. So again, we'll take time to see depending on the time we have. Why? So that we can appreciate or value why hand washing is important in the prevention of infection. And then the last, which is obviously to apply the skill of hand washing or improve on the skill of hand washing, because as you would see in one of the videos, it gives us the reasons why some of us might choose to wash hands and not choose to wash hands, but we'll get there when we go. I think this is by Heather Goliath, an Australian professor. So, infection control cannot be discussed without mentioning the term epidemiology. Probably some of you are familiar with it, but for those of you who are not familiar with it, epidemiology is defined as the study of diseases and patterns of disease distribution in populations, either in hospital or the community. In earlier years, this was used to refer to communicable illnesses, whether it is transmissible or not, and that's according to God. So epidemiologists' work mainly is that of surveillance to detect any onset of diseases and assessing impact of strategies for control. Are there any questions that I might need to attend to in terms of what we've done so far? Okay.
There's no hands up.
Thank you. Then one may ask a question: how is disease or illness caused, which is infection? Our topic, that is infection control. Literature reveals that infection or diseases are often caused by bacteria, which are one-celled organisms and are responsible for illnesses such as streptococcus that causes sore throat or urinary tract infections, and even tuberculosis, to mention just a few. Then we have viruses, and I think we're more familiar with that one because of the current pandemic in which we are. Hence, we are working virtually due to coronavirus that we have, or COVID-19. And then we have got the fungi, and then the parasites. Now that we know how infection is caused, we are to ask ourselves, how can we prevent infection from actually happening or occurring? Why do people choose or not choose to wash their hands? Maybe this is the one that now probably we can try and see, answer the first question. How can we prevent infection? Okay, we'll see next. So there is a 10-minute video that explains why people, or why do people choose or not choose to wash their hands. So I'm going to just unshare that and then share the video. Okay. So I might unshare because I forgot to put a tab for the volume. Otherwise you won't hear. This one is a bit low on volume, so I would say probably if you have got anything to use with your earpiece, that would be great. Thank you. So that's the one. If you want, you can take notes whilst this one is talking, because there'll be some questions. Can you hear, all of you?
Today, what I'm going to be talking to you about
Yes.
is hygiene.
Yes, thank you.
Why hand hygiene? There was so
Yes,
much
thank you.
emphasis given to hand hygiene, and really we can't be as bad as everybody thinks we are. However, the statistics and the audits that are done actually demonstrate that we're not nearly as good as we should be with hand hygiene. And yet we've known for an awful long time that hand hygiene is one of the simplest things that we can undertake to drop our infection rates. It was way back in the 1800s when Semmelweis first identified that if doctors washed their hands between maternity patients, that the infection rate dropped. And good old Florence Nightingale actually identified the same things in the 1800s. The more we washed our hands, the better our infection rates. Now, our infection rates aren't as bad as they were in the 1800s. However, there are still significant infections when patients come to hospital, and this needs to be addressed. So, let's talk about hand hygiene. Why don't people wash their hands? Why don't health professionals wash their hands? Well, my experience is that every health professional I've worked with, whether they be a nurse, an LPN, physio, dietitian, whatever, every person, health professional that I've worked with has been committed to good patient care and good patient outcomes. So it seems to me that it's not because health professionals don't care. So there has to be other reasons. And when I wrote the article about hand hygiene for Nursing Standard, I wrote it from the perspective of a human factors perspective. And what the discipline of human factors does is it looks at how people think, so cognition, how they act, and the relationship between that and the environment in which they work, and the people that they're working with, and the equipment that's available, the technology that's around them, and the interrelationship between those two things. So if we look at hand hygiene from a human factors perspective, we need to examine how people think. So there are three different ways that we undertake tasks, and they are skill-based, knowledge-based, and rule-based. Now, skill-based actions are those automatic actions, those things that we've done 100 times before and we do almost without thinking. And if you think about that in everyday life, it's when we're driving, when we're making a cup of tea, we don't need to concentrate, we can do those things, although when we're driving we should be concentrating. But a lot of our actions are skill-based actions. Now the thing with skill-based actions is they're very prone to slips and lapses. We would forget to do something, or we forget a step in the process. So that could be one reason why hand hygiene practices aren't good. The second type of actions are rule-based actions. And rule-based actions are actions where we don't actually know how to do things automatically, so we have to follow the rules. And they're prone to errors and mistakes if we actually use the wrong rule in the wrong circumstance. So if you apply that to hand hygiene, if we think the rule is that we have to wash our hands when we touch a patient, but we don't have to wash our hands, that the rule doesn't say it's after we touch the patient bedding, then that would be a mistake. Now, knowledge-based performance, tasks, undertaking tasks, is done from the knowledge that we have, and we apply the knowledge we have to what we're doing. And that's very prone to mistakes as well. And once again, that can be because we actually don't know when we should be doing, when we actually don't have the knowledge, when we should be doing hand hygiene. And that's been sort of validated by quite a few studies, and one of them that I can think of that was done in Australia, where
Thank you. So those were some of the reasons that obviously we may choose not to or wash our hands, as explained by Heather Goliath. Okay. So I'm trying to get the slide. Just give me 2 seconds. I might have something that I need to do that. Okay, just opened. That is the computer technical error. Hopefully we'll get there now. Okay. So are we able to list the 3 factors as explained by Heather Goliath, or can we remember what they are? I need 2 volunteers, those who can probably tell us at least 1 or 2.
They've got some hands up. Yeah, so we've got Anna's hands up, my hands up, and Jan's hands up.
Shall we start with the Jan?
So it maybe there isn't the facilities to wash their hands. So there's no water, no soap. So they haven't got the facilities available.
Yes, and what do we call those factors?
Environmental, was it? Or
You are correct. That is environmental or situational before under that. Okay, thank you, Jan. Anna?
It could be because people don't know that they need to wash hands, and these are knowledge-based, you know. The knowledge is limited, and probably they don't know the pros and cons, or rather the problems that potentially they might encounter by not washing hands. So knowledge-based.
Thank you, that's correct. And those fall under which category? That would be under rule-based.
Rule-based, yeah.
Thank you. Who was the third one? Thank you.
my hands.
I think that's knowledge-based, isn't it?
Um,
That's knowledge-based.
yeah, it could be. No, yeah, correct. Yes, and then,
That was my hands was up as well.
yeah,
So she also talked about the where you actually, I can't remember what she called it. She said that we make a sort of an instant risk assessment, if you like. So you think, oh well, the sink is miles down the end of the corridor, and I'm only going to be going up to that next person very very quickly. So you sort of almost make a risk assessment in your head, and you make a choice not to wash your hands in that particular situation.
thank you.
And I can't, she did call it something, sabotage.
Yes,
Was it to do with violation?
Violation, that's it.
yes, human violation. You're right, Anna. And you're right, because the first one was knowledge based, and then human violation, and then which is under rule based. Thank you. Thank you. That's well done. At least you're better than me to remember back. So yeah, those are there. So the three factors which are under human factors that fall into cognitive function, which is knowledge based, and you're right on there, and affective, how one acts, which is rule based as well, and then exceptional, people's choice, which is what Catherine was explaining, and then situational, which is what Jan had explained. Thank you. And then we come to second bit, which is we've said that, as explained, that infection control can be achieved through hand washing or use of hand sanitizer. Sometimes we use also personal protective, and in extreme, as we have seen in current pandemic, we use vaccines and sometimes even some antibiotics to manage that, which is a contentious subject for that one. And as some of the methods in this lesson will focus is hand hygiene. Is there any question or anyone wants to add on this one?
There's no hands up.
Thank you. Okay, now I would need a volunteer to show us how to do the hand washing. So I'm gonna briefly take off this the presentation so that we can see how we need to wash our hands. I know we have done it before, but before I can demonstrate, I just need to see a volunteer to demonstrate to us. Who's brave to do that? Jose, do you want to go for it?
I know you were going to go for it. Clothing is not appropriate, but I'll try my very best, because obviously one of the golden rules, if you're in a clinical setting, naturally correct me, because you've just come out from the acute this hospital ward environment, is that, you know, above elbows and things like that. So obviously, you need to have facilities to complete your hand washing techniques.
So as Jose is demonstrating, what I would want the rest of us is just to keep in mind, and at the end I'll ask each one of us to try and highlight if there's anything we can improve what Jose has done, or what we can complement what Jose has done. I'm not putting you on the spot, Jose.
No pressure at all. No pressure at all. And I would call it a technical glitch if I missed anything. So you apply your soap, your liquid soap to your hands, and you rub it between your palms, and then you start making rotations towards your what you call it interdigits between your fingers, putting into focus into your I can't remember.
Knuckles.
You have creases. You go around your thumb. How many seconds is it? I can't remember that you need to do. Is it 2 minutes nowadays? But I can't. We can discuss that later. So go around your thumbs all the way in between, and obviously and rinse after. The last time that I've had an actual practical demonstration of the hand washing was that I think it was the use of 2 or 3 hand towels to dry your hands effectively.
Thank you.
That is a nutshell my honest memory of hand washing technique.
Well done for your bravery.
Next time I will try to find an ultraviolet light to show you where the creases of my fingers are.
Brilliant,
This is
definitely.
gonna cost you a burger and chips again.
You're more than welcome. Actually, you get a chocolate.
Thank you.
So I'll go to the group, obviously, or to the team. How do we, what can we say, how did Jose fare, or what is it that we can add or we can take away from that? In terms of the technique, I can see Nikki Amy. Sorry, you're on mute, Nikki. You're on mute, sorry, I can't hear you. We can't hear you, sorry. Okay, it's all right. It's okay. We can hear you. I'll go to Jan then.
So, yeah, started off with soap, which is always a brilliant place to start, Jose. But it's a long time since I've been in a clinical setting, but it's going round your wrists as well.
Thank you.
So, and your tips of your fingers should go into the palms of your hands.
Yeah,
So you're doing both the palm of your hands and the tips of your fingers.
yeah.
I couldn't see all of Jose's hands because my picture is actually in front of him.
That's okay. Couldn't see. That's brilliant.
As I said to you, we'll call it technical glitch.
Thank you. We'll go to Anna. I think you are the first. Sorry, I jumped. Went.
That's okay, that's considered. You know what? Do we not get our hands under the water first and then take the soap?
Yes.
Yeah, I think
So
we don't take the soap first, but you take the water, then you take the soap, and I think the only, again, sorry, Jose, I couldn't see it because I'm blocking kind of your hands. But I think, you know what, this movement, isn't it?
yeah.
This
Yeah, the back.
thing for the backs of your arms.
Thank you. Thank you.
But I think, Jose, you know what, you're really brave and you did so well because it brought back memories from when I used to work in the clinical.
Absolutely. 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 And then lastly, Catherine.
Thank you. I was just going to say, from memory, I think about the timing, 20 seconds is in my head.
Timing 20 seconds. Thank you.
I think.
Okay, so I will put again. Okay, Anna, your hand is up. Okay, so okay.
No, and I guess the ones that how you dry or how we dry our hands, because obviously nowadays technology has caught up with us. We have air dryers and all sorts. I'm not sure whether they are available in clinical setting nowadays.
Well, I think as we can see, probably Natalie, I can see shaking hands. Probably wants to share something. Can we hear from Natalie?
Oh, it was just that we don't have hand dryers, unfortunately. Not in NHS hospitals anyway. We've still got the paper towels, and they're getting thinner.
Thank you. Nikki, can you come in, or you're still unable to be heard?
Can you hear me now?
Yes, we can.
Yes,
Yeah.
John. Okay. Right. I was going to say, the first thing I wrote down was naked below the elbow.
Yeah,
So no jewellery,
yeah.
no clothing. And I know that you said it, Jose, but that's kind of the first thing that comes into my head when I think of infection control. And then I wrote, I think following COVID, the preference, even if there is a hot air dryer, the preference is paper towels. And I only know this because when I went to Port Southwark last week, there's a sign up next to the air dryer that says, please use paper towels.
Thank you. Right, we'll go back to our PowerPoint. Okay. After this one, probably I'm gonna say we take probably 5 minutes break. But let's first go to this second. Okay. Okay, so yeah, I think so. That is the timing. To answer the timings in terms of how many minutes we need to take, between 15 and 20 seconds. And when I came across this one saying sing a happy birthday ×2 when scrubbing, it was interesting. It has made me to start to be to enjoy my music, playing guitar. It reminded me that. I think Anna, you might want this one. It does help. So when I tried it, it was really interesting. That is according to NHS National Patient Safety.
I've heard about it actually because my daughter, I think they do it in the school.
Yeah.
So I think when it all started, she used to practice here in the kitchen.
Thank you.
Me cooking next door. I don't know. Yeah, but yeah.
Thank
I feel
you.
so bad. I said 2 minutes earlier. I think that was still 20 years when I was a student, as I was told to do 2 minutes in the theatres before you can put your gowns and all sorts on.
What we say, as in adult education, we take everything, but we can unlearn that. So that's why we're here. Thank you. So hands are used every day. That's the reason we need actually to have them washed. Some of the reasons why should one wash their hands. Basically, obviously, we do so many tasks and we touch so many surfaces. And as you see when we proceed, why when I got actually alarmed in terms of the number of organisms on our skin, we'll see there. And then secondly, majority of infections and illnesses are spread by not washing hands with soap and clean water. Not washing hands harms population, which was another alarming statistic that I came across, that it is estimated that 1.8 million children under 5 years die each year with diarrhea. And you can guess, is it worldwide or is it within UK? I think I'll leave this one. I believe Kathleen, probably you might help me on this one.
I think that's a worldwide figure.
Thank you. Thank you. And by preventing illness, it is estimated that it also helps reduce work-related absenteeism as a result of flu and diarrhea, and we're in that season now. So even as we're at home, we need just to remember to take just a few minutes to do our hands. Otherwise, this might reduce that sickness rate, which as managers we strive to try and support our staff. And then I know somebody was going to ask a question about why we need soap. Soap produces lathering and scrubbing our hands, as Jose did explain, that we try to remove those microorganisms. Are there any questions up now? No? Okay.
There's no hands up yet.
Okay, so in terms of the choice, once I finish this slide, I'll just say probably a 5 minutes break for those who want just to stretch. I know we've been sitting about 30 minutes plus, so just to stretch a bit. Alcohol-based hand rub, which is our sanitizer that we use, reduces substantially microorganisms from our hands and has increased efficacy and is available at the point of care. That's why majority might prefer for it. However, its disadvantages is that it does not remove dirt and organic materials from our bodies. When they are visibly dead, we can't use it, whether at home or in a clinical area, and may not be effective in some norovirus outbreaks, which is another area that obviously we tend to hear about. That I didn't know about this until when I read about it, and requires that staff applies immediately before and after contact with patient. I think when Jan just came on this this platform, she mentioned a bit when she was narrating about how she met some people in the eating area. Whereas soap and water, the advantages is that it does reduce dirty and organic material that can be on our hand. That is a plus for water and soap. And it also reduces microorganisms, and it is cheap, readily available. But as we heard from the video, sometimes amenities are not easily available within where we work from or where we are, hence we may not be able to make use of it. It's effective even in the outbreaks, including norovirus, so that's another positive compared to the hand sanitizer. Disadvantages, disadvantages is that it requires that staff applies immediately before and after contact with patient, and it requires staff to use correct hand washing. I think we have got an example. I'm not blaming you, Jose, but we have an example that we might miss some steps, or because of the agency, we might skip some of the steps in it. That's what we might do. So I'll say, shall we take a 5 minutes break just to stretch? But if you want...
We've got hands up.
Okay,
Hands up.
yeah,
Hands up.
yeah. Can I have the question?
Yeah. So with the alcohol-based rub, does that not cause more skin irritation than using soap and water?
Sorry, come again?
With the alcohol-based hand rub,
Yeah.
does that not cause more skin irritation for some people
it is a good question. I think the answer is yes and no, in the sense that different people react, even with water and soap. As you would see, I think I've put another slide as we proceed, where either of these, some people are sensitive to the skin, so we need to look after our skin. That's why even the water, the advice is warm water when we're using it. Does that answer the question?
Yeah, that's brilliant. Thank you.
Thank you. So, yeah, any other questions before we take the break?
No, there's no more hands up. Yes.
Thank you. Or do we need to take a break? If we need to cruise, we can cruise. What is the consensus? I can't see.
I'm happy to continue.
Thank
I'm
you.
happy to continue.
Thank you. We're gonna continue.
Yeah, so am I.
Thank you. And then we have got when should one wash hands? So I think these are basic. Obviously, we have talked about them before. That is before and after eating food, or before and after preparation or touching raw foods, before and after any caring task, or after this task, that is using restroom, changing child's nappies, blowing our nose, coughing and sneezing. Again, we're in that season of the flu. Even when touching pets, I know I love my pets, so we need to just make sure that we look after ourselves. And even when we're putting our bins away, obviously we know we do wheelie bins to take them away. This can help ourselves and our loved one to stay healthy by washing our hands. Is there anyone wanting to add anything?
Can I ask something?
Yes, please.
Just thinking about when, so for example, in CHD, we kind of our staff don't be going out to do visits and things like that. So, and those might be visits in various different situations. So I'm just wondering if anyone's got any thoughts on when and where people should wash their hands during the kind of visits that we do.
Yes,
Because obviously we're in the community, aren't we, as opposed to the hospital setting,
absolutely.
so it is slightly different. You know, I know when I worked in the community, delivering vaccinations, for example, there was a very, very strict protocol about the number of times that you had to wash your hands before we even delivered the vaccination, and then in between X number of young people that we were vaccinating, you could use the sanitizer, and then every 10th patient we had these additional, they were more like, it wasn't like hand sanitizer, but it was like soap on a cloth, like
It was more foamy, was it?
yeah, foamy, can't remember what they're called now. Yeah, and you had to sort of wash your hands with those and just sort of wait for them to dry, and then you could be off again, and using the sanitizer in between individual patients, and then when we had a break, then we'd all go out and wash our hands again before we started with soap and water, so it was slightly different. So I'm just thinking about our CHC visits that we do.
I think in terms of the CHC, if I may take you back before or just when this pandemic did hit, our infection control did run some programs, infection control programs, and obviously it included using PPE that you needed to use. They provided, the provision that they gave staff that were going out was the hand sanitizer, and they encouraged that you use just clean, plain water tap to wash your hands, because you were not provided with soap. But those were the only things that we were provided with when we went out. And in terms of washing, we were advised before you actually go in and when you leave, and if you've touched anything, you needed to wash your hands. Does that make some clarity?
Yes, it does, yeah. Jose's got his hand up.
Yes, Jose?
Just a question, because I haven't been out to see patients since I joined the organisation. But correct me Anna, if I'm wrong. When we sent a colleague out, was there a pack or a kit that we need to pick up? That's the complete set of PPE, whether we need to wear it in full or anything. But my understanding is that should provide us fully what we need to
take
I
that.
remember that conversation.
I'll take that was a question. Basically, that's why we require our staff to be risk assessed for each task. So depending on the task, you may need to be provided with a pack, but if the task does not warrant you to take that pack, you may not need to take it.
Thank you.
Thank you. Shall we proceed, or there are more hands?
No, there's no more hands up here.
Thank you. So yeah, statistics, as I was saying, why I was a bit alarmed in terms of that. You can see about 1,500 bacteria live on our skin, just one each square centimeter. And now you can imagine a centimeter of your skin on our hand. And according to the study conducted in there, hand washing using water alone can reduce up to 23%, and that's massive. Really, if you say 23% of that 1,500 bacteria, that's quite a lot. And then with the whilst an addition of soap, it takes us to about 31%. So that's one of the reasons we need to actually develop that habit of hand washing, really. So again, I think Jose, you did demonstrate the hand washing, and there's been some addition and subtraction to make sure that this is a correct hand washing. So I'm going to proceed to show a picture of hand washing. Oh, sorry, I'm going to have to show the video instead of that. It's a video that will run just for 1 minute 23 seconds. So this one is a bit louder, so I need just to reduce a bit of the volume. Must remember to put my volume so that you can hear that. That is window. So I'm trying to see. Okay. I seem to have lost my video. Let me just see where it is. See it. Okay. That's technology that I need again. I need to unshare and share again. Okay, that. Where is it? Okay. So I've had a glitch there. It's not doing what I need. Can everyone see that?
Yeah.
Okay. So this is 1 minute 23 seconds. Just showing the sequence as we have said.
Is to wash your hands properly following these steps. Firstly, wet hands under running water. Then dispense 1 dose of liquid soap onto the hands. And wash the hands vigorously. Rub your hands through your palms, followed by the backs of the hands, between the fingers, concentrating on the thumbs and the webs, followed by the knuckles, the fingertips, and finally the wrists. Then rinse your hands thoroughly. And then dry your hands with a paper towel. And turn the taps off either using your elbows or with the paper towel. Dispose of the towel in a bin and always use the foot operated pedal and not your hand to open the bin.
So thank you. That was the sequence. I think that is probably a feedback to what Jose did and what we added in. Are there any questions? Thank you. So we're gonna go to the next slides for just to go. Okay. So that was the demonstration of the sequence in terms of hand washing. Then secondly, and that's the pictorial way of how we need to wash our hands. That is, wet our hands, 1 dose of soap, rub our palms, and then in between the finger webs, and then rotating, and then back as well, and then the big finger, and then the knuckles, and then the wrist, and then we rinse. That's how it should be done. And then that's how we would look under before hand washing. You can see if we were to put under ultraviolet light, that's how it would look before. And then in 6 seconds, that's how it normally sees that there's still some more bacteria within the fingers. And then at 20 seconds, we can see that we've taken out most of the bacteria from the hand itself, but within the nails, we still see some of them. That's how I would say horrified I was when we did it face-to-face trainings. Thank you. And then using hand sanitizer, there are certain things that obviously we cannot use with hand sanitizer if the hands are visibly dirty, as we have seen. And we need to apply enough hand sanitizer, obviously, to completely cover all the surfaces, because what we normally see is just tiny and it doesn't cover the whole surfaces of the hand that sometimes we carry in those small bottles when we apply on it. The hands should be rubbed together until the solution has evaporated. And the sequence is as shown below. I know it sounds funny, but that's how it needs to be done if it is to be done correctly. Similar to the hand washing, except we have taken out, I think, 2 steps. That is rinsing and water are out from here. So that's why we are at 10 steps. Any questions that I need to take?
There's no hands up here.
Thank you.
One observation for me, I just think it always amazes me how to the ultraviolet light, how it actually, the bacteria really does gather around the nail bed.
Yeah, absolutely. It just shows that that is the area the bacteria were difficult to remove them. Hence, we need to take that extra effort to wash our hands. And then remember, I think we are coming to the end of our lesson, and this is the guidance from England NHS to say we need to wet hands, apply soap, and then wash properly using the correct techniques, as well rinse and then dry with paper towel. Jose did mention about the towel. We no longer use towel. Towels are discouraged because they harbor quite a lot of microorganisms. As you would appreciate that if we use towels, we do not regularly wash them. That's the reason we are being discouraged from that. Even when we go to people's houses, if we can avoid those, it will be quite imperative. I know in that pack there's paper towels for us to use. And that's the summary. That's a summary of what we have just done, just to recap and to end our lesson at this point. Hands are the most common vehicles involved in transmitting infections from one person or place to another person. Hence, we need, and that's the reason why I chose this topic. Hand hygiene involves washing hands with water only, or water and soap. Recommended is non-bacterial soap with warm water. I think Jan did remind us in terms of caring for our skin, because if we do not care, again, others do have sensitive skin, and it is one of the prohibiting factors for people not to wash their hands. Correct hand washing follows 13 steps and takes between 15 to 20 seconds. Hand washing is recommended to be undertaken before and after care tasks or after touching raw food, even when we have used restrooms. Rivering is quite important in hand washing when we use soap, because it helps to lift the dirty, and scrubbing hands also creates friction, which helps lift the dirt and grease and microbes from the skin. As we have seen that human factors are blamed for people in making hand washing choices, hand sanitizer is recommended if hands are clean and do not have dirty. That's what we need to remember. At this point, what I might ask is, did each one of you receive the feedback form?
Yeah.
So I might say probably if we can take time to answer that, or you can send it to my email when you do it. I would appreciate if you did send them today for me. Whilst I close, are there any questions that I need to attend to before we close? I just want to thank you all for coming to support me in this lesson. Do we have any hands?
There's no hands up here.
So yeah, I mean, it's a shame that we can't meet in person, but technology has got its own advantages. Here we are, and thank you for sharing your knowledge with me.
Actually, Jan's got hers.
Okay, Jan.
Yeah, it's just to say thank you for doing it for us. It's one of those things that when you've been out of a clinical setting for a while, it's really good to have a reminder.
Thank you.
And it does, you do forget a few of the steps occasionally, don't you?
Yeah,
You think you're doing it right, and you think, oh, do you know, I don't think I've been doing that bit.
thank you.
So thank you for bringing that back into the forefront.
You are most welcome. So, I mean, as we end, that pre-reading, you can read it. And for those, I think it was it Julie that you did, you just glanced on it, is it? Is it Julie or is it Nikki?
It was Nikki that, yeah, I just lost as well, but yeah.
Thank you. Nikki, I'm going to post you a chocolate for that. Anna and Jan and Jose, for bravery, you also deserve a chocolate for answering some of the questions. And for asking some questions, Catherine, you might receive, I think, as well a chocolate. So thank you. And for Julie and Natalie, I'm not leaving you out. For your attending, you also have some sweets. I know the tricky is past, but you still deserve the sweets.
Natalie brought her recent acute skills, didn't she?
Absolutely, absolutely, yeah.
Memory for the rest of us.
So there is a present for everyone. Thank you. Thank you.
Well done.
Thank you for your support.
It's nerve-wracking presenting to colleagues, so well done.
Thank you. I appreciate, as I said, your feedback. Again, I can say, don't look at it as negative. To me, it is a developmental feedback. I will appreciate it. Thank you. Bye. Bye. Bang on. Yeah.